Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were dealing with the unnervous Vatas Vyadhi and we have started with the Aruchi in the last episode. In today's lecture, we will discuss another Vyadhi and it is called as Trushna. The thirst, excessive thirst, and in spite of drinking lots of water, patient doesn't feel satisfied with that water, and again he expresses his wish to drink the water because of constant thirst symptom. Now again, just like Aruchi, we have to think that whether Trishna is a disease or Lakshan. When there is a disease, you will find that generally there is no any other symptom other than thirst is present, and when it is a Lakshan, you will find that some other disease like Jwara, Udara are present, and thirst is one of the symptom in that diseases. So let us discuss first as a Trishna as a valley. Now I will put in front of you three cases. Thirst is a common symptom and nothing rocket science to diagnose when patient comes to you. Now you have three patients complaining of the thirst and you give the treatment for all these three patients. First patient is complaining that in the very hot summer, when I work in the hot summer, I get thirst. First thing. Second says there is a constant indigestion and then I get thirst and some coating of tongue also present sometimes. And third patient says that when I talk, if I have a talkative job like a call center or professor or any other thing, whether I have to talk constantly and so there is a thirst present. Now symptom is common in all these three patients, but you have to deal with the each one differently. Firstly, the patient which complains about thirst, which is works in the hot summer or which has work with the say in the kitchen in a hotel where there is a constant warm atmosphere, and he finds that because of that hot conditions I get thirst. Here you will have to think of the pitta dosh, and because of ushna guna, that ushna guna absorbs the jala dhatu in the body and patient complains of the thirst. Second patient which comes with indigestion, you have to think of the amaja trushna, and that amanirmiti is creating the thirst. See, in these two patients, the treatment will be totally different. Hence, you have to diagnose it properly as a what is the cause of the Trishna. In first patient, there is Pitta Prakop because of hot atmosphere, hot conditions of work. You have to think of the simple one, Shita Guna, like even cold water, cold drinks, cold juice to nullify that increase warm in the body. In second case, when there is patient says that there is some disturbance in the GI tract and I have got indigestion and also I feel thirsty, you have to think of amapachar, and in that case the cold water is contraindicated and you have to think of the all ampachan dravyas which are ushnayin dravya, ushnayin guna, and also you can have a warm water to reduce that thirst. So symptom is same, Trishna, water is required, but in first case you have to deal with the cold water because Pitta Shaman is expected, and in same way water is indicated, but it is a hot water for the Amapacham in the second case. Hence, as I said, that the root cause diagnosis is very important. Now, what happens in the third case? That patient says that I have to talk more, I have to go on the bike, and so there is I have to constantly again come across the winds, etc. Here, the thirst symptom is because of dhatukshay, because of vatapakop, and there is a constant rokshata, dryness in the mouth. So in these patients with which have got a profession which is creating such symptom constantly, ask them to drink water again. uh, as it is vatapakop, warm water is advisable, and ask them to choose something even like chocolate, or you can have sugar cubes also in the mouth, so they will provide a snigdhata when they are doing their job of talking. So that constant uh, chewing of chocolates or some sweets, snigdha padartha, will keep the mouth moist, and also because that snigdha guna, rukshata, will be under control. In these patients again, you can have a dhatu vardhak uh, pathya, like even a warm milk which will reduce the vata and which will give strength to the vocal cords and all this area which is getting dhatukshay during their work of the work of talkative nature. So Trishna symptoms same. In the first case, cold water, pitta shamak, all these things. Second, warm water, ampachar, ushnaviratmak dravya, though there is Trishna. And third patient, you have to use snigdha padartha, which will relieve the dryness of the uh, all this mouth area, and also it will increase the dhatukshay, or it will replace dhatukshay. So madhur shita dravya are advisable. In our practice, we rarely come that these symptoms are okay, these are common symptoms, but we rarely come across that Trishna as a disease itself, that in spite of no other conditions in the body and patient is complaining only of the Trishna, is very very rarely seen. And if seen this in, as I just gave you examples of three patients, if they came to you, you will find that the upashay is very quick enough. Just increase the rasakshay and all these causative factors of ampachan etc., and the trishna is relieved. So I took this subject because in the grantha trishna has described as a disease, so I have to analyze it. But I have not seen much patients that they come to that they came to me with Trishna as a disease only and without any other systemic conditions. So in next lecture we will discuss the Trishna as a lakshan in many diseases, and which is a very prominent lakshan we come across in our practice. Thank you very much.